Hey everyone, it's Dr. Morales back at it again. Frequently asked questions related to plastic surgery. So the question of today is, I just can't believe I haven't answered this question yet, and it's a very debatable topic, and I kind of get it and I kind of don't. But the question is when can I sit on my butt after a BBL, or Brazilian butt lift? And that is really, in my experience, not an issue. So I don't tell my patients they can't sit on their butt after just a fat transfer procedure. The technique of the procedure is that the fat's put in multiple layers on top of the muscle. It's just above the muscle fascia, within the fatty tissue, on top of the fatty tissue, and just under the skin. It's layered. And the purpose of that is so you increase the circulation around the fat transfer so it survives. So it's really spread over the diffuse area of the entire butt and usually the hips as well. Sitting on your butt or being in a reclined position in a bed or a sofa or something soft is not gonna change the outcome of the shape. You're not gonna lose the volume. I do this procedure with a tummy tuck all the time. I've done thousands. Does not do anything. You have to believe me. And even I tell my patients, they still don't believe me. But I do it all the time, and I don't see outcome changes. During the fat transfer procedure and the grafting, I actually do quite a bit of massaging that I learned from a massage therapist, and it takes a lot of force to shape the butt. It really does. I have to use my whole body to kind of get it to shape the way I want it. And then once it's shaped right, it's done. Like, you don't have to mess with it again. But it would take a significant amount of sitting on a hard surface, like let's say a church pew or metal chairs at a restaurant, or hard bench or something like that. We're talking about 4 or 5 hours to cause a permanent dent. Like, it takes a lot of pressure for a long time. But that's typically not the case for people who have the surgery. You're either on something soft, bed or sofa or recliner or something like that. You're not going to have the pressure to cause distortion. I assure you of that. You will be very, very uncomfortable within 30 minutes before you let your body do that. Okay. The next thing of it is that the softness of being something soft is super important. So for me, when you have surgery with me, you get this little booty pillow. So it's a memory foam pillow. I had patients who are just overly concerned about sitting on something. I found something that's affordable. It pretty much fits everybody. Please sit on it. If you don't want to sit on it, okay. But this obsession, I'm gonna mess up my butt. You're not gonna mess up your butt. But if it makes you feel better, here's a pillow. Okay. Despite all this counseling, and you'll hear it if you choose to have surgery with me, some women are just deathly scared to sit on their butt, and they won't do a tummy tuck with the BBL, or they'll do a BBL and they'll lay on their stomach for 3 or 4 weeks. Completely unnecessary, but if it makes you happy, whatever. As long as you're happy, I'm happy. But it will not change the outcome if you sit on your butt. Some surgeons recommend not sitting on your butt. I'm not that guy. It just doesn't make sense anatomically to me. I haven't seen outcome changes, and it's quality of life. It's just not fun. The only time I don't let anybody sit on their butt is when I do butt implants, and that's super important. That's a whole different level of surgery. You cannot sit or lay on your side on your butt for 2 weeks with butt implants. Big difference, and there's big, huge reason why not, which I've explained in other videos. So, if you're considering the surgery, and I know you're searching this question a lot on the internet, you're considering surgery with me, this is the answer. Sit on your butt. It's gonna be fine. You're not gonna mess it up. It's gonna be okay. You'll feel more comfortable, I promise. So hope I answered your question. Thank you for watching, and I'll see you next week.